For colon cancer screening, we either do a fecal occult blood or fecal immunochemical test or FIT or colonoscopy. So one of the frequently asked questions to me is that if a patient doing an FIT, they are asked to do 2 FIT tests on day 1 and on day 2. So what if the first one is negative, the second one is positive? In other words, not the two are not concordant. Of course, if both are negative, they just need to do the FIT 1 year later. But if one is positive, they can just go and do a scope. What if the first is negative, the second one is positive? What do they do? I have a few patients, some of them do it wrongly. They did 1 more FIT. The third one being positive, they see doctor for scope. The third one being negative, they don't see doctor. That is wrong. And that's some patients of mine, after the first negative, the second positive, they do another FOBT, the O test that is negative. That is also wrong. Actually, studies have shown if both are positive, they have a high chance, up to 8 to 10% having a colon cancer and about 40% having a large colon polyp. So you have 2 FIT positive. You must see the doctor as soon as possible, to do a colonoscopy as soon as possible, because about 8 to 10% of this type of patient may have colon cancer. Up to 40% of them may have a large colon polyp. But what if the first one is negative and the second one positive? Such patients have been well studied in European and American studies. Roughly about 1 to 1.2% of them may have colon cancer, and roughly 20% of them may have a large colon polyp. In other words, when the first is negative, the second one positive, they still should see a doctor. They shouldn't ignore it, even if and there's no point in doing the third one, because regardless of what the third one show, either positive or negative, they will still need to do a scope. So why is it that some patients don't have a positive FIT all the time? And that's because even if a patient have cancer or a large polyp that bleed, they may not bleed every single day. So if they don't bleed, if it bleed intermittently, the first test may miss it, the second test will increase the accuracy. So to sum up, to do FIT testing, do 2 on 2 consecutive days. Any one that is positive, you need the scope. No point repeating a third one. That is incorrect. So when anyone positive, do check with the doctor, discuss with them about colonoscopy, which is a safe procedure to pick up early cancer, pick up polyp and remove polyp. FIT, colon cancer screening, have been shown to reduce mortality.